Okay, so Martha, you are one of the nurse practitioners in our Powell office, and you specialize in hormone optimization. Can you tell me a little bit about what brought you into loving hormones, kind of your journey into healthcare, and why you specialize in what you do?
Sure. I was a nurse for 25 years before I became a nurse practitioner. And so I brought a lot of experience to the table, mostly in cardiovascular surgery and emergency medicine. And then when I went back to NP school, I did some of my clinicals with functional medicine physicians and basically just fell in love with hormones. I loved how intricate they were, how delicate they were. I loved balancing them on each individual person, trying to figure out what's going to make them feel optimal. That led me to, I didn't start out right in hormones then. I did that during clinicals. Like I said, I loved it. But then I went and did some walk-in health therapy. I did some wellness training. I became a health coach. And then I spent a good portion of time back in the emergency room, taking care of patients as a provider. And that was a really good experience for me because even in the world of hormones, we specialize so much, but people come in frequently with episodic ailments and rashes and infections. And so I don't discredit how important that was for my career. But about 3 years ago, I got into the world of hormones and went through really exclusive training. I feel privileged to have gone through WorldLink training, and it took about 2 years to take all of their courses. And just really learning more about the sex hormones and about thyroid and adrenal health and gut health. And it has really afforded me an opportunity to meet great people who are vested in their care. We pay good money for this type of care. And I feel like when you have some skin in the game, it really makes you vested in what your provider is educating you on and helps you to really be more of a participant than in Western medicine. And I love that aspect of functional medicine where we are participating together. I like to tell my patients, you're in the driver's seat. I'm going to be your co-pilot and kind of educate you along the way, but you're in the driver's seat and the outcome is really, on you. I'm here to supplement and help you. So that's kind of how I got going. The symptoms that bring people into the world of bioidentical hormones are different. Even women who are young moms are going to present with different symptoms than women who are going through menopause. Some of the most typical symptoms that will bring a patient to see me are overwhelming fatigue or feeling like they need caffeine frequently throughout the day to stay stimulated, all the way to brain fog. When they get closer to menopause, you can have vasomotor symptoms like hot flashes and night sweats. They can have vaginal dryness, painful intercourse. Their libido goes down. And this can even start in your mid 30s, late 40s. Any age group can go through this where your hormone levels drop and the interest in sex goes down. Joint pain will be a frequent one too. People just feel stiff all over. And a lot of times, any age group will have weight problems where they've gained weight. They're not where they used to be when they were in high school and college. They feel thick in the middle. They feel bloated. They get like that overhang on their pants and they just don't like it. People don't like that with stubborn weight gain. So that's kind of what will bring a lot of women to see me. Men have similar symptoms. I think a lot of times with men, they don't realize kind of how crummy they feel until they get on testosterone and they realize how amazing they feel. And then they look back and be like, wow, I really felt horrible. Whether it be job stress or family or finances, guys, stressors are just a little bit different than women. So they present sometimes with similar symptoms, but I see more of maybe they've lost their sense of well-being or confidence. And they will have some fatigue. Certainly erectile quality comes into play when you talk about males, and they may not like the quality of their erections, or they just don't feel like they're in the mood or can perform the way that they once did. So, and the same brain fog and things like that. So there's a lot of different symptoms. It's another thing that's cool about this kind of medicine because each person is really different what their presenting symptoms will be, but it doesn't mean that the underlying cause is all that different. A lot of times it's from lack of hormones or an imbalance of hormones.
So why do you think, I feel like it's become more popular? We've been doing this for a while, for a long time at Vitality, but more people are becoming aware of it. And it seems like it's becoming more popular of a topic to discuss. Is there a reason why it's becoming so necessary and prevalent
I think my answer is twofold. The most obvious about why it's becoming more popular is that I think we're seeing a lot more information coming out in social media and out in the public eye. More research is being done. A lot of the world's opinions about hormones came from the Women's Health Initiative from decades ago. And it was really a kind of a bogus study because bioidenticals and synthetics were in the same study. Obviously, some really adverse reactions happened and blood clots and cancer. So the whole study had to be aborted. But when they really peeled away the different parts of the study, the bioidenticals were, the people that were on those were protected. And it was really the conjugate estrogens that caused a lot of the problems. So education and good research and evidence-based medicine has come forward with good information that has proven that these are very efficacious. They're very safe when prescribed appropriately. I think just heightening our social awareness of the topic is one reason. I think for a lot of my patients, the other reason is when you optimize someone's hormones, and again, this can be anything from adrenal health to gut health to the sex hormones, thyroid. But when people start feeling amazing, they tell their sister and their friend and their neighbor. And so, you know, it kind of feeds, just like when you get a great pair of shoes, you tell people where you got them. So when you start feeling amazing, when you get optimized and balanced out in your hormones, I think you tell people, and that just spreads. It's almost like the best medicine. You don't have to advertise. It's just, we are focused on disease prevention. And it felt so good to get out of that world of disease management where you're just giving people a pill for everything. Now I'm actually preventing them from needing those medications. It's so awesome. It's better to really look down deeper at the root cause. Sometimes it's vascular disease. Sometimes it's stress or cortisol levels. So there's a lot of different things. And a lot of times it's hormone just depletion or poor diet. So I like looking more at what's going on the inside and let's fix the problem.
Sure. And that functional medicine approach of we're going to find that root cause versus kind of add some band-aids or some buffers in there. So overall, when we're talking optimal hormone, so whether that's, or optimizing hormones, whether that's improving them or balancing them, or whatever, why for overall health, why is that super important?
Because from the day you're born, we're in a constant state of decomposition. You know, we're born with the cells that you're going to have, and as we age, as our hormones levels fluctuate and our adrenals get tired and our ovaries are going through perimenopause where they're not working well, and then menopause when they don't work at all these changes are happening in our bodies. And so the receptor sites to receive these hormones start to downregulate, and that's when your body starts to break down, or you start feeling the dysfunction of not having those circulating hormones. So if you combine that with the fact that the typical SAD American diet, which is the standard American diet, is filled with a lot of processed foods, a lot of fillers, a lot of sugar and additives, a lot of chemicals. The American diet, and then the stress that we take on as a nation, even in the last year, it's gotten so much worse, but we don't manage our stress properly. We might drink more alcohol or eat more, or how do we compensate for stress? Really has a lot to do with how well our adrenals are going to function. And so managing it comes from, you know, doing it better and doing it differently. So hydration, sleep, intentional breathing, stretching, yoga, prayer, meditation, instead of running to a pill necessarily. And some people do need medication to help with some of their psychiatric and psychological issues. But a lot of times it's that we don't do enough self-care. So to answer your question, I think it's important because our body will break down, and then we will end up in Western medicine. We don't want to end up with hip replacement, or we don't want to end up with glaucoma, or, you know, heart disease, high blood pressure, diabetes, insulin resistance. A lot of the metabolic dysfunction comes from lack of hormones and then diet and not managing. So it is really important because we want to live optimally. And, you know, our goal in functional medicine is add life to your years, not just years to your life. Most of us are going to live longer than our parents did. The generations live longer, but what state of mind and what state of physical health you want to be in during those years. We want you to have a life of vitality.